Am I audible and visible? Let me know, then we'll continue. Hello, Kishan. Hello, everyone. Am I audible? Fine. Hello, everyone. Am I audible and visible? I think I am audible. Okay. Hello, Kishan. Good evening, beta. Welcome to my class. Hello, everyone. Welcome to my class. I myself, Dr. Deepthi Kare. I am MD PhD Physiology and your educator for physiology. Okay. Now, in today's class, hello, Kishan. Okay. In today's class, we will discuss about degeneration and regeneration of nerve fiber. That is one of the important topic that may be asked as a short note. Okay. Before starting my class, I would like to inform you all that all my class notes are available. Okay, soft copy as well as hard copy of all my notes are available. Respiratory system, Kishan, I will start one by one. I think 1 month is required to complete one system. Okay, so I hope within my 1 month, if I am going to finish this system, I can start the next one. And I think within 2 to 3 months, I'll be having respiratory system. Okay. So now, but if you are connected with me, I'll definitely finish all your systems before your university exams. Okay, if you are watching me live, that is very good. Or if you cannot watch me live, you can just watch the recorded videos also. Same thing is available, recorded videos also. Fine. So all my hello Sakshi, good evening, beta. So all my notes are available in soft copy as well as hard copy. If you wish to get soft copy, you have to download the application Vesalius, which is available on the Play Store. Okay. And you have to subscribe and you can get all my notes in soft copy. And for hard copy, it is available in the form of book. Uh, yes, Kishan. Harivanna College. Yes, I know that you are from Harivanna. Fine. Okay. So hard copy is also available in the form of physiology notes. Fine. Okay. That you can order from Flipkart or Amazon. Fine. And one more another announcement here is if you are there with me, I'm going to finish the whole physiology syllabus. So stay connected for completing your whole syllabus. Fine. Now, so today we will discuss one of the important topic, that is degeneration and regeneration of nerve fiber. Okay, fine. So here what happens, what do you mean by degeneration and regeneration? Okay, so here what is degeneration and regeneration? First of all, we will define degeneration and regeneration. Whenever there is injury to nerve fiber, here suppose there is injury, okay, different types of injuries we will discuss. But after injury, what happens, there are, you can see, destructive changes. This destructive changes and followed by constructive changes, and this destructive changes are degeneration and constructive changes are regeneration. Okay, following now injury, various degeneration or destructive and followed by constructive changes occur. Okay, now degeneration, first of all we will discuss about degeneration. This degenerative changes, they occur at three places. Number one, they occur distal. So this is cut end, distal part. This is known as distal part. Okay, this is known as distal part. Degenerative changes are known as anterograde or Wallerian degeneration. Why is it known as Wallerian degeneration? Because it was first described by Augustus Waller in 1862, and from the name of the Waller, that is Wallerian degeneration. Fine. Anterograde means changes in the distal cut end. Suppose this is cut end, so distal part. Fine. And proximal changes, they are known as retrograde degeneration. Proximal to the site of injury, the changes are known as retrograde degeneration. Fine. And third type of changes, the changes they occur in the cell body here also. If there is injury, changes also occur in the cell body. Fine. So there are three types of changes of degeneration. We will discuss one, that is anterograde or Wallerian degeneration or distal part changes, retrograde degenerative changes or in the proximal part, and third, that is changes in the cell body. Fine. Now, what are the causes of injury? First of all, we will discuss that. One, that is nerve transaction. Suppose there is cutting of the nerve, injury that cuts the nerve through and through. Okay, that is one cause. Second, if there is crushing injury, crushing also results in degeneration of the nerve. Some toxins, some poisonous neurotoxins they are known as. If they are toxic to the nerve, neurotoxins, they also degenerate your nerve fiber. If there is ischemia, ischemia means decreased blood flow, interruption of the blood flow or blood supply. Fine. Okay. Hello Anshu. Good evening, beta. And hyperpyrexia. Pyrexia means increased temperature. Hyper means very high temperature. That is when it is more than 40.5 degrees Celsius, that is hypoxia. These are the commonest causes of injury. I repeat, one is transaction, second is crushing, third is toxins, poisons, ischemia, and hyperpyrexia. Try to remember all these causes, okay? Now try to remember the whole answer with me, so that will be fruitful. The class will be fruitful. Now, grading of the injury. This is one of the very important questions sometimes asked. 5 degrees of injuries. There are 5 degrees. Okay, try to remember all these 5 degrees at present now. Okay, and these gradings were given by Sunderland. Okay, or Sutherland. Okay, that was Sutherland. Fine. So these are 5 degrees. Now, so first degree, that is just compression. This is commonest type of injury that occur. Suppose if you are sleeping on particular hand for the whole night, and if your position results in compression of the nerve, so pressure, this is the commonest cause for the injury. Sometimes you may feel that you have numbness. Suppose you are sleeping on your hand and you are compressing your nerve, so this is commonest injury, most common type of injury. That is also known as Saturday night palsy. Saturday night palsy. Why Saturday night palsy? Because in foreign countries, on Saturday they drink, and after drinking they are sleeping in whatever posture they don't know. So at the Saturday night, this kind of nerve injuries are common. Okay, and these are reversible injury. Now another important thing, this first degree injury also known as neuropraxia. Fine. Now here what happens, you can see when continuous pressure is there. Okay, because of continuous pressure there is ischemia. Okay, and because of ischemia blood flow decreases, and anoxia, lack of oxygen supply. Okay, so temporary there is impairment of nerve function. Nerve functions are lost temporarily. Fine. Okay, and here you can see only compression that results in demyelination. Only myelin sheath that is destructed. Axon is normal. Axon destruction is absent. Means axons are normal. Fine. Another important thing here is there is the person is having only defect in the conduction. Okay, conduction block, and that is also temporary. Okay, temporary, the person is not feeling some sensation from that area, and that is known as Seddon's neuropraxia, and it will be corrected by its own in few hours or few weeks. Fine. So this is very important. First degree injury, neuropraxia. Try to remember. Easy way, NP, neuropraxia. Fine. Second degree injury. Now here in second degree injury also known as एक्सोंटेमेसिस, याद रखना ये सब नाम. ठीक है. First degree neuropraxia, you can see just pressure, so myelin sheath is lost only, otherwise axon is normal. Fine. Okay. Second degree injury known as exontemesis. Here what happens, there is damage to axon also, myelin sheath is also lost. You can see this axon is also lost, but endoneural tube is intact. I think we have not discussed the structure of nerve. The nerve has got, suppose this is your nerve, one nerve. Okay, so nerve is made up of nerve bundles of nerve fiber. Here you can see these are the bundles. Fine. So here one nerve fiber, this is, or axon, that is covered by connective tissue covering, that is known as endoneurium. Okay. Now multiple axons or nerve fibers, they are covered by this one. This is known as perineurium. Okay, and all these bundles, all the fascicle, this is one fascicle bundle. All these fascicles are covered by this covering, that is epineurium. Okay, fine. So here, first of all, you can see in case of second degree injury, okay, nerve damage is severe, means your axon is lost as well as myelin sheath is lost, okay, and the cause is prolonged and severe pressure or accident that results in death of the axon also. But very important thing here is endoneurium is intact. Okay, you can see here outside covering, this is very important thing in the second degree injury. Because endoneurium is intact, regeneration is possible and it is complete. Okay, fine. So in second degree injury, the regeneration is possible. Okay, then comes your third degree. Third degree is neurantemesis. Like axon, now you have to change it to neurantemesis. I repeat all the three. First degree is known as, repeat, neuropraxia, only pressure demyelination. Axontemesis, there is prolonged pressure, axon is also lost, but endoneurium is intact. And if endoneurium is intact, then regeneration is possible. Third, neurantemesis, here endoneurium is gone. So now regeneration is not complete, not complete regeneration is possible. Fine. Now, so this is third degree. Okay, fourth degree, you can see there is severe damage. You can see here this third, fourth, and fifth all are known as your neurantemesis. Okay, in this 3, 4, and 5 degree, regeneration is not complete. Okay, so you can see severe damage to nerve. Now your epineurium and perineurium of the nerve is also interrupted. Okay, so fascicles, suppose this is one fascicle, these are all fascicles having nerve fibers. Okay, this is one. So this is your epineurium, this is perineurium, and this is endoneurium. Okay, now you can say epineurium and perineurium are also interrupted. So all the fascicles, fasciculi means bundles, the bundles are also disturbed and disorganized. So regeneration is poor and incomplete. Fine. Then comes your fifth degree. In fifth degree, what happens? You can say there is complete transaction. You can see, suppose this is the nerve, so that is getting separated, the whole, like this, cut through and through cut. So regeneration is not at all possible. Okay, how can we regenerate? That is corrected by surgery is required. Both the ends should be sutured, ना? But no, now के both the ends से उसको पकड़ के suture करना पड़ेगा. Then only correction is possible. Fine. So this is about your different degrees of injury. Am I clear? I repeat, first degree is neuropraxia. Neuropraxia is prolonged pressure that results only in demyelination. Second degree, that is axontemesis, axon is lost, endoneurium is intact, regeneration is possible. Third degree, there is neurantemesis. Here in neurantemesis, what happens? There is endoneurium is lost. Fourth degree, endo and peri both are lost, and fifth degree, the whole nerve fiber is completely separated. Fine. Okay, now we discuss about degenerative changes. As we have discussed, what is degeneration? Degeneration, that is deterioration or impairment or pathological changes that occur in injured tissue, changes in injured nerve. Okay, fine. Am I clear? I repeat, degeneration, that is deterioration, impairment, or pathological changes that occur in the injured tissue. Okay, now here you can see, suppose there is injury here, so changes occur in the distal part, as we discussed, proximal part, and the cell body. And this distal part changes, they are known as orthograde degeneration or anterograde, we discussed. Okay, proximal part retrograde, and third that is transneuronal. Transneuronal means suppose your this neuron is damaged, then this neuron ends on some other neuron. Okay, so the neuron to which this is getting synapsed, that is also having changes. Suppose this is one neuron. Okay, it has synapse with the other neuron. Okay, so suppose this is to be cut, then this neuron also getting degenerated. This is known as transneuronal degeneration. Fine. Now, which are the changes they occur in the distal stump? Distal means suppose injury is here, distal to this here, orthograde. This is known as orthograde degeneration or Wallerian degeneration. Okay, why Wallerian? Because it was described by Waller in 1862. We discussed. Okay, now this degeneration is it is completely degenerated, and this degeneration process starts within 24 hours after injury. Okay, if there is injury after 24 hours, this degenerative changes they start. Now, what are the changes? First is functional change, action potential changes they occur. This changes occur as early as 2 days, and after third day, ability of the nerve to conduct impulse that is decreased, and after fifth day, no impulse is evoked. Okay, so and another important thing, this degenerative changes they continue to occur for 3 months after injury. Fine. Okay, so now which changes they occur we will discuss. So first is changes in the axis cylinder. You can see here, this is the injury, so this distal part. Okay, which of the changes occur? Changes in the axis cylinder. So here you can see, because axon is degenerated. Okay, so what happens? There is a swelling of the axon. Axon become irregular, then it is broken down. You can see here. Okay, neurofibrils which are present inside the axon, they are also getting broken down. Debris is collected. Okay, so you can see here, instead of having your normal nerve axon, you will be having this disintegrated tissue. Okay, debris is seen in the space, and that is occupied in your tube, endoneurial tube. Fine. Then comes what happens. So first change they occur in the myelin sheath. Second occurs, first change they occur in the axon. Second change that occurs in the myelin sheath. Okay, so myelin sheath destruction that occur in two stages. Number one is physical, second is chemical. Physical destruction means you can say that it takes about 8 to 10 days physical destruction. There are little or no changes they found in the histology. Okay, then chemical destruction means this you can see physical destruction takes 8 to 10 days, and chemical destruction starts after 8th day to 32 days. Now what are the changes here? You can see this Schwann cells, they release their enzymes, as well as macrophages are also there. This macrophages and enzymes of the Schwann cell, they cause destruction of myelin sheath. Okay, and your myelin sheath is mainly made up of lipids. Okay, which lipids are there in the myelin sheath? We have cholesterol in the myelin sheath. We have sphingomyelin. Sphingomyelin mainly cerebroside and sphingosine. Okay, cerebroside that you will discuss more in your biochemistry. But cholesterol and sphingomyelin are there, so they get destructed. Okay, because of macrophages and other important thing, that is your enzymes of the Schwann cell. Okay, so myelin sheath gets changed. Now next is, if this degeneration takes place in the CNS neuron, okay, then there is no regeneration. Why there is no regeneration? Thank you, Dr. Sheetal. Why there is no regeneration? Because in central nervous system we don't have Schwann cell. Okay, Schwann cells are required for regeneration. We don't have endoneurium and neurilemma. Neurilemma mainly, that is sheath of Schwann cell. Fine. So in CNS, when the neurons are damaged, there is no further changes take place. Only there is degeneration of axon, degeneration of myelin sheath. Okay. Now here you can see, if this damage takes place in the peripheral nerves. Fine. If the damage is there in the peripheral nerve, further changes they occur. Now what happens? You can see here. After that, your macrophages, they come. Now what do? This macrophages, they come from outside and they digest the whole debris. Now they clear the tube. Okay, so this macrophages, they invade, they come from outside, they digest the debris of the axis cylinder and myelin sheath disintegrated products. Okay, so this neurilemmal tube, okay, this becomes empty, you can see here. Okay, it gets cleared up. Okay, so this can be later on filled by the Schwann cell. You can see here, these are the Schwann cells, they later on fill this neurilemmal tube. Fine, so these are the changes, they occur in the peripheral nervous system, not in the central nervous system. Okay, now after this debris is cleared by your macrophages. Okay, what happens now? This neurilemmal sheath, that is intact. Okay, it is not affected. So what happens now? Your Schwann cells, that is not properly seen here. This is regeneration. Okay, so Schwann cells, they are getting proliferated. Okay, and they feel the neurilemma. Okay, the neurilemma tube is filled by the Schwann cell. Okay, now Schwann cell nucleus, it starts multiplying, it gets divided mitotically, mitosis of the Schwann cell takes place, and they feel this endoneurial tube. Okay, fine. Now, so these are the changes, they occur, we have discussed in the distal part to the injury. Fine. Then comes changes, they occur, you can see here, these are your macrophages, these are the Schwann cells. Okay, then comes your changes, they occur at the site of injury. Okay, you can see here, suppose this is the site of injury. Okay, so mainly from the distal end and also from the proximal end, these Schwann cells, they are differentiated and they form elongated cells, Schwann cell. Fine. Now if the gap is 3 millimeter only, this gap will be filled by the axon. You can see from proximal end, axon starts growing. Okay, and it will enter into the distal end, and this axon, it moves at a rate of 1 to 2 millimeter per day. Now uh, but if the gap is more than 3 millimeter, that will not be filled by this axis cylinder which starts from the proximal end, so that surgical correction is required. Okay, so this is, we have discussed about changes, they occur at distal end. Now we'll discuss changes, they occur at the proximal end. Okay, suppose this is the injury, which changes they occur here in the proximal end. Okay, and this is known as retrograde degeneration. So we first have discussed orthograde degeneration. Okay, or changes occur in the distal end. Now retrograde changes occur in the this proximal end. Most of the changes are similar to distal end, and but these changes, they occur only up to 1 or 2 nodes of Ranvier. Okay, nodes of Ranvier, or 1 or 2 one or 2 nodes of Ranvier up to the myelin sheath. These pathological changes occur. Fine. Now, so which are the changes now? Another thing is, which are the changes, they occur in the cell body here after degeneration. First and foremost, that is chromatolysis. Okay, one of the important thing here is, this changes, they start within 48 hours after injury. Okay, and up to 15 to 20 days, these changes are found. Okay, first is chromatolysis. Chromatolysis means nasal granules are disintegrated. Nasal granules are disintegrated. Golgi apparatus, mitochondria, they all are disintegrated. Neurofibrils also, they disappear. Nucleus moves towards the periphery. You can see here, this is the normal cell in which nucleus in the center, this is in the periphery. Fine. There is entry of fluid inside the cell, so cell becomes swollen. Sometimes nucleus may come out of the cell, and if nucleus comes out of the cell, there is no regeneration. Nucleus is must for regeneration. Fine. Now, what are the changes, they occur in the proximal and retrograde degeneration? We have discussed all the changes, same as the distal end up to the first or second node of Ranvier. Fine, we have already discussed. Now, next important thing is transneuronal degeneration. As I told you, suppose if this neuron is getting is your nerve fiber is you can say that cut. So what happens, this axon ends on the second neuron, changes also occur in this neuron, and this is known as transneuronal degeneration. Degenerative changes, they occur on the injured neuron, but also it will be seen in the other neuron to which this neuron, this one, gets synapsed. Fine. First examples are, number one, suppose you can see here that optic nerve, if you are knowing that optic nerve starts from the neural layer of retina. Okay, this optic nerve that ends in the, or that passes through the lateral geniculate body. Okay, you will learn more about this in vision physiology, but if this optic nerve is degenerated, you find changes in the lateral geniculate body also. Okay, another important thing is, suppose this is your spinal cord. Okay, this one, these are dorsal horns, this is dorsal horn, ventral horn. Okay, so if this posterior nerve roots are degenerated, what happens? Changes also occur in the dorsal horn. Okay, or suppose your cerebral cortex neurons are affected, changes they occur in the ventral horn also. Fine. So this is known as transneuronal because this pyramidal cells, they end on the ventral horn neuron, and the sensory neurons, they end on the dorsal horn neuron. So you will find changes in this different neurons if proximal to that neuron is damaged. Fine. So this is transneuronal degeneration. Now we'll discuss about regeneration. Regeneration, it starts along with degeneration. So it is not like that degeneration gets completed and degeneration starts. So the regeneration also starts by fourth day of injury. Okay, it becomes active after 30th day. Okay, and complete recovery depends on the type of nerve fiber and so many other factors. Okay, now which are the changes and which are the factors they affect regeneration? Number one, that is, regeneration is fast if there is crush injury. Then the cut ends are separated. Suppose like this, if both the ends are separated, then the regeneration is not fast. Okay, but if there is crushing injury but the nerve is nearby, if it is cut but nearby, then regeneration is fast. Okay, so cut ends are near to each other, regeneration is fast. If two cut ends are in the same line and they are not moving, then it will be fast. Neurolemma. What is neurolemma? That is the sheath of Schwann cell. Sheath of Schwann cell. Okay. Neurolemma, if it is intact, then regeneration is possible, and this is the reason why regeneration is possible in CNS neurons, not in the peripheral nervous system. Fine. That is neurolemma which is required, and nucleus is also required. So these are the five factors. Number one, crush injury, when cut ends are near to each other, cut ends are in the same line, neurolemma is intact, and nucleus is present. Fine. So these are factors which are required for the regeneration. Now, what are the changes they occur in the cell body during regeneration? You can see here. This changes, they start by 20 days and completed by 80 days. Okay, completed by 80 days. Okay, here what happens, first of all, nasal granules, they appear, then Golgi apparatus, they also reappear, cell gets its own size, cell loses extra fluid. Okay, and nucleus also comes back to its original position. Okay, so these are the changes they occur in the cell body. Then changes occur in the distal part and at the site of injury. You can see here, suppose this one, there is degeneration. Okay, then as we have discussed, macrophages, they come and they destroy this debris, axon and myelin debris. Okay, after that what happens, your this endoneural tube is free. Okay, or you can say endoneural tube is empty. Now your Schwann cells, they feel this endoneural tube. Okay, then what happens, your from proximal end, you can see here, from proximal end and this sprouts, they originate, this sprouts, or you can say axis cylinder, part of the axis cylinder, that is known as regenerative sprouts or pseudopodia or fibrils. about 50 to 100 fibrils they originate, and they are moving in different direction, but one of them that enters into the distal part, and it is guided by Schwann cells. Schwann cells, they guide this fibril. Fine. Hmm? So one of the fibril enters in the distal part. Okay. Now after 2 to 3 weeks, okay, you can see here as these fibrils are developed, these are all okay. Fine. And one of them enters in the distal part. Fine. All fibrils they are reinnervated, reinnervating one tube that degenerates. All the fibrils they degenerate, only one which enters in the tube that remains. As we have discussed, 50 to 100 fibril pseudopodia they originate, from which only one remains and all are regenerated. The rate of growth, that is 0.25 millimeter per day initially, but when it enters in this distal part, this growth rate is very fast, that is 3 to 4 millimeter per day. Fine. Now this, after that, within 15 days, that myelin sheath is formed. Your Schwann cells, they form myelin sheath around the axis cylinder which is formed. Okay. Then gradually diameter of the nerve fiber starts increasing. Then gradually functional recovery is also started. Motor nerve fibers, they get complete recovery as compared to sensory and autonomic fibers. Okay. Now some of the complications may also occur. What are the complications? Number one is, sometimes when this fibrils they enter in the distal part, sometimes there is area of anesthesia is developed. Okay. If there is damage to the sensory nerves, they cannot carry their own functions normally. Sometimes the person is having misinterpretation of sensation, means sometimes person is having tingling, numbness sensation, misinterpretation of sensation also is present. Then anatomical complications, which are those: number one, if the gap is more than 3 millimeter, then this proximal end will not enter in the distal end. Okay, so we have to correct it with the surgery. Okay, when nerve fiber damage is very much severe, then also there is atrophy takes place. Sometimes there is neuroma formation. What is neuroma formation? Here what happens, this proximal end, from this proximal end, okay, during regeneration, this nerve fibrils, those who are growing from the proximal end of your axons, they don't reach to the distal end. Instead of that, they are going somewhere else and they produce neuroma. Okay, so here what happens, that there is you can say that there is a wall like mass is produced here instead of going into the distal end. Okay, and this mass is known as neuroma, and this mass is painful. One of the example of this is phantom limb. What is phantom limb? Phantom limb or phantom limb pain. Suppose somebody's limb is amputated, you can see here, limb is amputated, the person is having nerve fiber here, so from proximal end this sprouts they originate. Okay, they don't find anything distally, so they form a wall like part, there is a neuroma, and this neuroma is painful. The person feels either there is pain or there is presence of limb and pain. In absence of the limb, that is known as phantom limb pain. Okay, what is the reason? Because this proximal uh, tubules, they are not getting their way distally. Fine. So this is neuroma. So this is all about degeneration and regeneration. Now it's time to discuss few questions. Okay, those who are watching me live, they can give answer, and those who are watching this video later on, they also can give the answer, or they can also write down their own answers. Okay, so let us start with the question. Number one is Wallerian degeneration. It refers to, number one, degenerative and regenerative changes occur in a cut nerve fiber. Second is retrograde degeneration of axon up to the cell body. Degenerative changes, they occur in the distal part, and degenerative changes occur at the site of injury. Okay, if you can answer, I will give you 15 seconds. if you can answer. We have discussed Wallerian degeneration, that is, what is Wallerian degeneration? Okay, fine. Uh, so the correct answer is degenerative changes, they occur in the distal part of the cut end. Fine. Second question, complete transaction of the nerve, that is which degree of nerve injury? First, second, third, fifth. First, as we have discussed, that is neuropraxia. Second, exontemesis. Okay. Third, neurantemesis. Third, fourth, and fifth. Okay. Here only pressure is there. Only demyelination. In exontemesis, we have endoneurium intact. Endoneurium intact. Here, endoneurium destroyed. Here, epi and perineurium are also destroyed, and here there is complete transaction. So this is your fifth degree. Fine. Third, degree of chromatolysis following nerve injury depends on all of the following except type of the neuron affected, nature of injury, distance of lesion from the cell body, and myelination of nerve fiber. Here it will not dependent on your myelination. Okay, it will depend on all these three type of neuron, nature of injury, and distance of the lesion. Next is chemical destruction of myelin sheath following an injury to nerve fiber is due to chemical destruction, as we have discussed, by enzymes of Schwann cells and macrophages, or both, or none. Okay, we have discussed that this debris of myelin sheath and excess cylinder, that is removed by Schwann cell enzymes as well as macrophages. So your answer, correct answer is both of the above. Fine. Next is neuroma is, we have discussed, cancerous condition of nerve fiber, degenerative and regenerative changes in the peripheral nerve after injury, painful collection of nerve fiber at the site of injury, and area of anesthesia following sensory nerve damage. And the correct option is, as we have discussed, painful collection of nerve fibers at the site of injury. Okay. First change to occur in the distal segment of cut, and we have discussed myelin sheath or axis degeneration or Schwann cell mitosis or sprouting. We have discussed that first change to occur, that is axonal degeneration. First your axon gets degenerated, then myelin sheath that gets disintegrated. Fine. Neuropraxia, that is a type of physical conduction block, axonal disruption, endoneurium disruption, nerve trunk disruption. We have discussed neuropraxia, that is first degree injury. Here only you can say that in first degree only there is demyelination, so conduction is blocked. Fine. Then exontemesis include discontinuity of, we have discussed neuropraxia first, that is conduction block, then exontemesis, and then neurantemesis. Exontemesis, that is discontinuity of endoneurium, and neurantemesis, that is discontinuity of perineurium and epineurium also. Fine. So this is endoneurium. Okay. Then comes motor march, that is seen in exontemesis, neuropraxia, and neurantemesis. Motor march means, suppose this is your proximal end, from proximal end these sprouts they originate and they will go to the distal end. Okay, and this is possible in case of second degree injury where your endoneurium is intact. And which is the second degree? As we have discussed, first degree is neuropraxia, second degree is exontemesis, and third degree is neurantemesis. So this motor march is seen in exontemesis. Fine. Last question. First degree injury we have discussed. Easy one, that is neuropraxia. First degree conduction block neuropraxia, second degree exontemesis, third degree neurantemesis. Fine. So this is all about today's question. Okay. Let me again announce that all my topics notes, they are available in soft copy as well as hard copy. If you wish to get soft copy, you can download the application Vesalius and subscribe for the same. And if you wish to get hard copy that is available in the form of physiology notes, that is a book, and that is available on Flipkart as well as Amazon. So you can order it also to get the copy of all the notes. Okay, fine. And in this book physiology notes, I have given all the topics in the form of question answers. Okay, suppose in your university you have a question like degeneration and regeneration, so the question and the whole answer that is given in the book, so you need not have to refer the whole textbook. If you are just reading this book, that is sufficient for undergraduates of MBBS, nursing, physiotherapy, homeopathy and all. Okay, so thank you so much. Thanks for watching me. Okay, if you like my video, you can like with all your friends, you can share, you can like, you can share with all your friends, you can subscribe my channel, and after subscription please hit the bell icon. बेल आइकन क्यों दबाना है कि मैडम जब भी ऑनलाइन होंगे तो आपकी भी घंटी बजने लगे कि मैडम अभी क्लास स्टार्ट कर रही है. ठीक है, तो सब्सक्राइब कर लो, बेल आइकन लगा लो, सो आपको हमेशा पता चल जाए. बहुत सारे स्टूडेंट्स है लेट एंट्री करते हैं, अभी अभी 2-3 स्टूडेंट्स है वो लाइव चैट में एंटर हुए हैं, वॉच कर रहे हैं. सो डोंट बी लाइक दैट. वेन एवर क्लास स्टार्ट्स, try to enter in the class so you can understand the whole topic. Fine. And if you cannot be able to join the live class, you can watch the class later on also on my channel. Okay, thank you so much.